Hello and welcome to FairCareMD. My name is Alex Fair and I'd like to tell you a little bit about how FairCare works and why we started this site. A few years ago I was looking for a new dentist for my kids. The old dentist that we had I wasn't really that wild about, and he wanted a lot of money just for a checkup. So I went around shopping for care and I found that it was pretty difficult to do. I could find doctors who looked great on paper, but then they would want to be paid an exorbitant amount if I was paying directly. I would also find doctors who had reasonable fees but then weren't particularly good based upon reviews and ratings that I found online. So I decided it was time to create such a thing. Eventually I did find a great dentist, and he actually became the very first FairCareMD, and now my kids love him. They've got great dental care and all that, and he's really just a great guy. But I figured that if I could do it for myself, why couldn't we create something for everybody? So now we've got hundreds of doctors in the system, mostly in New York, but we are starting to spread all over the country. So look for what you need, and if you can find it, great. If you can't, then tell us exactly what you need, and we will help you find it in your area. We've done this all over the country for hundreds of people, and it's really starting to catch on. When you look at what's happening with healthcare in America, it's hard to imagine the current plan being particularly helpful for doctors or patients. It's great for insurance companies. Okay, everybody has to buy insurance, but the insurance seems to be getting worse. We all have higher deductibles now than ever, and the doctors are being paid less and less. Meanwhile, the insurance companies are doing great, right? So invest in the insurance company, but buy yourself a high deductible plan is our recommendation, and then use something like FairCare to get reasonable prices for care. So, for example, if I have a $5,000 deductible and I have a family of 4, which I do, then it makes sense for us to pay $100 out of our pocket when we go see a great doctor, and then to put that against our deductible. And then, God forbid, something happens, we always still have the high deductible policy where we can go to the hospital or what have you. But most of our care is actually out of pocket now. So we use FairCareMD to get MRIs and to get neurology visits, or to get whatever we need to get. Another important thing about FairCare is it's intensely private. I don't want anyone to know what kind of care I'm getting. Okay, they don't need to know about any of my medical problems. That's why all of our settings for your profiles on FairCare are defaulted or set normally to be keep it private. So privacy is very important to us, and we think it's very important to you as well. You can also set it so that you don't have to keep everything private, but that's your choice. So those are a couple of things about FairCareMD. Basically, how it works is you search for the care that you need, you select what you're looking for, you ask for a lower price if you don't see a price that you like, and you make a contract for care with that doctor. So that's FairCareMD. I'm Alex Fair. If you have any questions, please call 954-FairCare, or you can email us, or you can click that feedback button and tell us exactly what you think. Thanks for visiting, and have a great day.